Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Drugs for hypothyroidism. For hypothyroidism, there are two drugs which can be given. One is T3, which is called as Liothronine, which is T3, and we have T4, which is levothyroxine. So Liothronine is T3 and levothyroxine is T4. What is the differences between Liothronine, which is actually T3, and levothyroxine, which is T4? So Liothronine is more potent, whereas levothyroxine is less potent. Liothronine is actually short acting. Levothyroxine is long acting. Liothronine is actually drug of choice for myxedema coma, whereas levothyroxine is drug of choice for long-term management of hypothyroidism. For long-term management of hypothyroidism, we use levothyroxine. But for myxedema coma, which is a emergency for emergency treatment of myxedema coma, we use T3.
thank you and thank you for watching.